Okay, hi guys. Good evening, Dr. Rajarathna here. So today is the orbit and quiz. Orbit and trauma quiz. We'll discuss the questions. So the first question that I would want to discuss is about the pleomorphic adenoma of lacrimal gland results in, and the question was about the type of proptosis. So pleomorphic adenoma of lacrimal gland is going to be here, right? So the superior-temporal of the orbit with respect to the roof. So when that enlarges, it's going to push the eyeball down and in. So it's a down and in proptosis. And one more question related to that, a very often asked question, what is the most common tumor of lacrimal gland? The most common tumor of lacrimal gland is again pleomorphic adenoma. So two questions I've already discussed. So one is the type of proptosis. It's going to result in a down and in displacement. Which one? The lacrimal gland tumor, pleomorphic adenoma. And the most common tumor of lacrimal gland is again pleomorphic adenoma. Okay. And what the other question that we would discuss is scleral rupture is suspected after trauma. Which of the following is not a feature? See, whenever there is a scleral rupture, first of all, where is the most likely site of scleral rupture? It is going to be at the limbus. See, although the thinnest part of the sclera is just behind the rectus, incision of rectus, the most common site of scleral rupture is at the limbus and diagonally opposite to the direction of trauma. Alright. So suppose somebody hits you from here, that is inferotemporal, your sclera will rupture supero-nasally that limbus, supero-nasal limbus. Okay, so that's what I mean by diagonally opposite. So that is one, and definitely there's going to be an aqueous leak. Yeah, aqueous leak is going to result in a very soft eyeball. So if you touch the eyeball, it's going to be as soft as butter on palpation. And so that was number one option, soft eyeball, which is true because the IOP is going to decrease, the aqueous is leaking out, decreased IOP, which is second option, which is again true. How would you detect aqueous leak? Siedel's test. We will discuss Siedel's test in another video. So that is also true. What is the fourth option? Blepharochalasis. See, blepharochalasis, when you have an excessive of conjunctiva, excess conjunctiva will, there will be a sagging of the conjunctiva, especially when you have can be in old age, or in allergic conjunctivitis you can have conjunctivochalasis. Oh, the answer was option was blepharochalasis. See, blepharochalasis, when you have too much of lax skin of the eyelid, you'll have blepharochalasis. That can happen in old age. Yeah. So blepharochalasis has nothing to do with trauma or scleral rupture. But yes, some of you, 30% of you guys, 30% of you have answered blepharochalasis, and I think you all took the bait, because it was a very fancy sounding word and you said blepharochalasis. Blepharo is eyelid and chalasis is that excessive lid skin which is sagging and hanging. Okay, so it cannot be, so that is not the answer. So the question was scleral rupture is suspected after trauma. Which of the following is not a feature? So yes, you get a soft eyeball, you get a decreased IOP, positive Siedel's test, but no blepharochalasis, no dermatochalasis, okay, nothing of that sort. Alright, so the rest of the questions we'll discuss on the EyeMentor app at 10 p.m. It's free access. Okay, so what is the difference? Please ma'am tell the guys, today is what? Yeah, today is orbit and trauma. How will I discuss in this? Huh? We'll do it on retina quiz day. Okay, so join the quiz. Retina quiz is over, no? But yes, the discussion is still pending on the app as well. So you can join that and I'll discuss it there. All right? Yeah. So we'll keep it concise and to the Gajendra, everything I'll teach here. What only I'll teach on the app? Just a short, no, not now. See, today we'll keep it as orbit and trauma. Even if you had some doubts on orbit and trauma, I would have very well explained. But I'm EyeMentor Dr.Rajarathna app. Just go on Google. I will put it in the comment as well, comment section, how to download. On Google Play Store, it's just EyeMentor Dr.Rajarathna. If it is your iOS app, it's a little tricky. I'll give the procedure. I'll put the step-by-step instruction to join the app. It's a free discussion, the quiz discussion. So Gajendra, if you have any doubts in orbit and trauma, yes, most welcome. You can ask me today. And tomorrow, I think tomorrow is squint or refraction. I guess tomorrow is squint test. So if I'm doing that particular quiz discussion, Okay, orbital trauma. What do you want, beta? You want me to teach you about orbital flow fracture and the teardrop sign? Now, what exactly is your question? I don't understand your comment. See, orbital flow fracture is when you have a blunt trauma. Okay, so whether it's a road traffic accident or somebody hits you. So what happens is when the object, especially when the object hits the orbital rim, the flow, right? So the trauma, the force of the trauma gets carried back and the flow will fracture, especially close to the infraorbital groove. So it will fracture in the posterior medial aspect of the orbital flow. Okay, so it will crack there, and some of the orbital content, see, the major orbital content is orbital fat. So the fat will prolapse. So when you have the floor here, what is below the floor? You have the maxillary sinus, right? Maxillary sinus is basically an empty space containing air pocket, air. So this orbital contents will prolapse into the maxillary sinus. So that is why it's called blowout fracture. Like you've seen babies, no, when you change their nappies, there's a blowout. There can be a blowout when it comes out beyond the nappies. So like that, it goes beyond the orbital 30 ml. So it's called blowout fracture. And the teardrop sign is when you see on Waters view on X-ray. You all know Waters view. So when you see on Waters view on X-ray, normally, X-ray air will be black in color. So now you have a soft tissue which is prolapsing down. So that soft tissue will appear grayish white, like a teardrop or a water drop. Yes, so that is about your blowout fracture. Okay. Yeah, today you joined the quiz, no? So I've given you questions which are covering a lot of topics, so we will discuss. So is this clear? This blowout fracture, and the teardrop sign. So teardrop sign you can see on X-ray, you can even see on CT. You can even see it on plain CT. When you do a coronal section, you can see it there as well. You go and read this view and all. This is too much, no? और क्या मैं गूगल आंटी हूँ? मैं बता सकती हूँ, but मैं बताना नहीं चाहती हूँ, ठीक है? Because you also have to read. You read. If you have any doubt, you ask me. That would be better rather than me, going on a monologue telling you stuff. It should be two ways, no? What do you say, Gajendra? When we have the next schedule of orbit and trauma, by that time I think you can read the Thangavel peer review, any other view that you want, we'll read. Because आजकल इतना एक्सरे भी करते नहीं है ना हम. Okay. Alright, so I will stop here because I have to prepare for the 10 o'clock class. Chal, bye. So tomorrow's session, I hope you know what is tomorrow's quiz, right? What is the schedule? Schedule according. One second. Neurophthal, orbital trauma. Bache, can you just help me with? Okay, so tomorrow will be squint. 9th October is squint, right? So, so tomorrow we will discuss some questions from squint. Yeah, the schedule is there, no, Chirag? Sorry, yesterday I wasn't well, beta. That is why yesterday we didn't have the discussion. We do it, right? Even beyond INICET, we will be having the quizzes. EyeMentor, EyeMentor, and my name, Dr.Rajarathna. Okay, so that's the name of the app. I'll put it in somebody put it in the comment box, yeah. What is this? Acha. Alright. Okay, so actually we are pending with the discussion, so we will do it 10 minutes. Na? Kar lenge. Okay, chalo. Bye. Yeah, as my YouTube name. Yes, that's right, Gajendra. That's right. Chalo guys, see you tomorrow. I hope these small things are going to be useful for you. Alright. And participate in the Telegram quiz also, Gajendra. It will be useful for you. Alright? Chalo. Bye.